the daily update on the coronavirus situation in Victoria. So as already reported earlier today, we reported 603 new cases yesterday of the coronavirus in Victoria. All 603 were locally acquired. This brings us to exactly 6,000 active cases across the Victorian community at the moment. Sadly, a woman in her 70s from the Hume region passed away, and we pass on our deepest condolences to her family, friends and community, and yet another reminder about the tragic toll that COVID brings. There are currently 241 people in hospital with COVID-19. 60 of these are in ICU and 39 on a ventilator. Of the cases who were in hospital yesterday, 85% were not vaccinated at all, 13% were partially vaccinated, and that leaves 3 people who were vaccinated. We reported and processed 48,829 COVID tests yesterday, and we delivered 40,811 vaccines through state-run clinics, and in partnership with the rest of the distribution program, a significant number significantly above that. And I did see from the Commonwealth's figures late last night that Victoria delivered more vaccines than any other state yesterday. And I think that just goes to point that there is a very strong appetite for Victorians to go out there and get vaccinated, because they know it's both the pathway to delivering on our roadmap, but it's the pathway to getting to the other side of this pandemic. We are now sitting at 73.4% of our community having received the first dose of the vaccine, and some 44.4% receiving the full second dose, with numbers increasing every day and all being subject to the continued provision of supply from the Commonwealth vaccine program. Children aged between 12 and 15 have come on in recent times through both state and GP clinics, and since they've come on, 52,000 children and rising have had their first vaccine in that 12 to 15 age group. Some 57,000 plus people made bookings through the state-run clinics yesterday, and many more, I'm sure, through the GP network. We have more than 4,900 AstraZeneca and 6,200 Pfizer vaccine appointments in the system, in the state-run clinics, ready to be booked now over the next 7 days. And I would urge Victorians to come forward and fill those, as they have been, at record levels as quickly as they possibly can. Before I pass to Minister Pallas to talk about last night's construction decision taken by the Chief Health Officer and reflected in the decision in the public health orders, I just wanted to briefly reflect on the lead-up that has got us to this significant step. We've stood here almost every day for several weeks now and talked about this outbreak and its particular focus on the construction sector in all of its diversity. We've talked about COVID outbreaks on construction sites, one particular site so far having more than 150 direct cases linked to its operation. We've referred to multiple cases seeding from metropolitan Melbourne into the regions, given the highly mobile and young permitted workforce that has been the construction sector for the past 18 months. And we've also reflected on poor levels of compliance with health directions and poor levels of application of COVID-safe principles and practices in multiple workplaces, big, small and in between. Our public health team has analysed the spread in this industry of the COVID virus and how that has played into the public health team's decision to take the significant measures that it has overnight. There are currently 403 direct cases linked to construction, which in turn is linked to 186 construction sites. Of these 186 construction sites, 151 are in metropolitan Melbourne. Of these 151 Melbourne construction sites, there are 362 cases directly linked, and of those, 49 of them live in regional Victoria. And that's before we then measure the impact of the direct cases through their community transmission, their household transmission and other exposure sites. And of those 49 in regional Victoria, most of them, not all, but most of them reside in now the lockdown areas of Ballarat, Geelong and Mitchell Shires. So, as we've always said with permitted workers, particularly in the construction sector, because of its age, its mobility and its diversity, the responsibility of staying open comes with the responsibility of minimising the spread of virus through staying open. As a result of these figures, the public health team was left with no choice but to hit the pause button and continue working with the sector over these next 2 weeks to improve compliance, to improve COVID safety in the industry and slow the spread of the virus so as to protect that workforce, their families, the communities they live in and the wider Victorian community. I'll ask Minister Pallas perhaps to take us through some more details on the sector. Then the Chief Health Officer will make some comments around the wider outbreak and its direction, and then we're happy to take questions. Thank you.
Thanks, Minister. And it is a sad day, I think, in many ways, for a lot of the construction industry workers, a lot of people who've been doing the right thing, that unfortunately aberrant behaviour amongst a minority has led to a very substantial public health risk that the Minister is taking you through, and I'm sure the Chief Health Officer will be happy to elaborate. But what we have seen is a need for the government to intervene and take strong action consistent with the Chief Health Officer's orders in order to protect the community, but also to protect those workers, their workmates, their families. What we are seeing as a consequence of these events is the construction industry is effectively amplifying and spreading the virus into communities, particularly in the north and the west of Melbourne, but also the southeast, and then back into other workplaces, because the nature of this industry, both a young industry and a highly mobile industry, is one that moves across a variety of workplaces. So we put the industry on notice, you'll recall, a week ago that we needed to see a substantial improvement. And we made it very clear then that the permitted worker status would be reviewed if, in fact, those issues were failed to be adhered to. Since then, we've seen poor compliance and further transmission sites being identified, and that just cannot continue. We can't simply have an industry as one of the focal points, one of the greater areas of activity of the virus spread in the community, not adhering to the safe requirements for work that we put in place. There is non-compliance across a range of construction sites. You'll recall when I spoke to you last week that we said that we would put a safety blitz in place. We were hoping to get over a 2-week period something like 7,000 inspections done. We haven't got there yet, but what we do know is close to 50% of the sites inspected have failed to meet the safety requirements when they've been inspected by authorised officers. So there's been a spread of transmission from site to site. and transmission into households from there. The issues are not just limited to CBD construction. Of the enforcement activities undertaken over the last week, there has been a very high non-compliance rates identified. We've also seen some appalling behaviour on our streets, which in itself is a public health risk. And can I be clear that we've got no tolerance for the kind of behaviour that we saw take place outside the CFMEU offices. Having spent a long time working in the trade union movement, I can assure you that sometimes this government does not see eye to eye with the trade union movement. But we've always had a respectful engagement because we recognise that they do vitally important work for their membership. And their safety, their membership safety, is vitally important to them. And of course, a safe workplace, which is what the CFMEU officers are, is vitally important to this government, as it is for us to every workplace. So what we saw the other day was reprehensible. So we're acting, can I say, decisively and without hesitation on the back of the Chief Health Officer's orders. Chief Health Officer, of course, has the responsibility to take these actions, but we stand without hesitation or reservation in support of those orders, and we believe that they are absolutely appropriate in the circumstances. I met with industry stakeholders and union representatives together with Minister Allen and Minister Pakula last night, and we made it clear to them that the orders would issue and that we would take the necessary steps implicit in those orders to protect every single Victorian. And it can't be that a permitted worker category carries with it some implied entitlement to put the rest of the community at risk. It does come with an obligation, and that obligation is to ensure that every Victorian, to the extent that they can impact upon it, is protected by their right to be able to go about their trade, a right which is not available to a lot of other people in this community. Ultimately, the government was left with no alternative but to shut the industry down, shut all work on site in the construction industry for a 2-week period. The construction industry must take this opportunity, and I'm sure, I have been assured, will take the opportunity to reset and to restart the industry. And that is vitally important. We cannot simply go back to the way things were being conducted. Broad-scale non-compliance across the industry that was constituting a threat to public health in the most dramatic of terms. The construction industry, I think, has made it clear that they too share the values that the government has around making sure that the industry is reset, restarts, but in a safe way, and that the changes necessary to get the appropriate approvals to commence work are underway. So we do recognise that there are a number of workers and builders who have been doing the right thing, quite a number, and for them this will be a source of considerable disappointment and, might I say, economic trauma. So we haven't taken these steps lightly. We are very conscious of the implications of the decisions we've made, but it's necessary really to protect workers in the industry and the broader public. All construction projects in metropolitan Melbourne, in the city of Ballarat, the city of Greater Geelong, the Surf Coast and Mitchell Shire will be closed. There will be a strictly limited exemption for those workers who are involved in the process to attend the site, to deal with an emergency or to perform urgent and essential work to protect health and safety, but the process of demobilising these sites will commence immediately. An amnesty has been put in place so that a limited number of workers can attend the construction sites in order to assure the demobilisation of those sites is done safely. It is a difficult task to close this industry down, to stop its economic activity, and it will be an equally challenging time to start it up again. and an enormous amount of work will be required to get there. All government construction projects in metropolitan Melbourne and the relevant LGAs that are subject to the CHO's orders will be closed, with no new work to be commenced, other than work required to make the site safe and secure. The health and safety of every Victorian, of course, is our #1 priority, and the government will take all steps required by the Chief Health Officer to render public safety our priority. So that goes for construction workers who can, of course, as I told you last week, get vaccinated, and they'll need to be vaccinated. We've made it clear that the shutdown will reduce movement, it will minimise transmission, and it'll also allow the entire industry to appropriately adopt the Chief Health Officer's directions, including increasing vaccination rates. All sites will be required to demonstrate compliance with the CHO's directions prior to reopening, including the requirement for workers to show evidence that they have in fact been vaccinated, had one dose of the COVID-19 vaccine before they returned to site on the 5th of October. So from 1 minute to midnight last night, all construction workers will require at least one dose of the vaccine, from 11:59 on the 23rd of September. The timeline is that all workers will require at least one dose. Of course, given the shutdown in the industry, we'll be able to ensure that the requirements to meet the opening obligations of the Chief Health Officer have been met well and truly in time for the 5th of October anticipated opening. So we're going to continue to work with stakeholders. This is going to be a very difficult time for a lot of people. I also will make the point that Minister Pakula and I are having discussions about what we can do in terms of support and assistance for particularly the smaller operators in the industry, and of course the disaster relief payments that are available from the Commonwealth will be available to employees in the industry as they are affected by Chief Health Officer orders. So on that basis, I'll hand over to the Chief Health Officer, and then I will be more than happy to take any questions you have.
Thanks, Treasurer, and good morning. So just to the wider outbreak in Victoria, in terms of the distribution of cases, we continue to see the majority of new cases very much in the northern suburbs of Metro Melbourne, with 40% of all today's cases in Hume LGA alone. So in the north, 242 cases in Hume, 53 in Whittlesea, 56 in Moreland, 14 in Darebin and 12 in Yarra. So overwhelmingly in Hume, but Whittlesea and Moreland also with some substantial caseloads. In the west, 47 cases in Wyndham, 39 in Brimbank, 20 in Melton and 12 in Hobsons Bay. That's looking a bit more stable. And in the southeast, we do continue to see a slow and steady rise in cases in the southeast. 11 in Glen Eira, 10 in Casey, 6 in Cardinia and 8 in Port Phillip. For regional Victoria, there have been 10 new cases overnight, 3 new cases in Mitchell Shire. They are all known close contacts. There are now 25 active cases in Mitchell Shire, and they've all in some way got a connection back to the rest of metropolitan Melbourne. There have been 3 new cases in Moorabool. All 3 are in Bacchus Marsh. At least one was a known contact who was in isolation, and we're looking further into those additional 2 cases. There's been 1 new case in Ballarat, not currently linked to other Ballarat cases. There is a suspected link to a case from Melbourne who works in Ballarat. Currently there are 18 active cases across 6 households, and there are more than 350 close contacts in Ballarat currently. There's 1 new case in Greater Geelong, a known close contact. 1 new case in the Macedon Ranges with a suspected link to Melbourne under investigation, and 1 new case in Bass Coast, who's a household contact of a known case. There are now 4 active cases in Bass Coast, all in the same household. In terms of current outbreaks, probably the outbreak of greatest interest is Meadow Heights Aged Care Facility. There are 15 cases there now, 11 staff and 4 residents. 94% of staff are fully vaccinated. The remainder have had 1 dose. So, you know, as per mandated requirements, but not with that full protection that 2 doses brings yet. 77% of residents are fully vaccinated, some partially vaccinated, and of course some have declined, as is their right. Affected residents are being transferred out of that facility. In terms of vaccinations, look, it's really all good news. We've seen a significant ramp up in vaccination in the north and west of the state and the north and west of Metro Melbourne. In key LGOs over the past week, we've seen first dose coverage grow faster than the state average, which is actually about 6% growth over the week. But in Hume, first dose coverage has grown 9.5% in just a week to now be at 64.5% coverage. In Wyndham, it's grown 8.3% to 75% coverage, so that's greater than the state average. And in Melton, it's grown 7.7% to reach 67.5% first dose coverage. Whittlesea's grown 7.3% to reach 63.5%. Casey, Cardinia, Greater Dandenong and the southeast have also seen growth at a higher than state average rate. So it's really encouraging. Wyndham will catch up with the state average and likely overtake it. Hume is coming from a lower baseline, but again, really significant uptick, and hopefully will overtake the state average, because we really see an overlay with the highest number of cases, the highest growth in cases, overlaying the lowest vaccination coverage, LGAs, in Metro Melbourne in particular. So the higher the vaccination coverage is that insurance against transmission, against high case numbers and high growth rates in those cases. Our targeted vaccination pop-ups have been hugely successful. Just yesterday at the Australian Islamic Centre in Newport, more than half of the attendees were born overseas from 43 different countries. We've completed the Narrawarren South College pop-up with more than 3,700 doses administered in just 3 days, and more than 850 doses were administered in a single day yesterday at the Dandenong Plaza. So vaccination is absolutely our path out of this. It is our collective protection against COVID-19. I've got clinical colleagues who are reporting, ID physicians who are reporting treating people with severe COVID illness who are not vaccinated, who are not anti-vax. They simply didn't get around to it, didn't think it was a matter of urgency or didn't prioritise it in their lives. I'm telling you, it is a matter of urgency because, as the Minister has referenced this morning, 3 out of 241 people in hospital fully vaccinated. All of the rest not completely vaccinated. If you are completely vaccinated, you are protecting yourself from that risk of being in hospital and very much from the risk of dying and the risk of being in intensive care. So please treat it as a matter of urgency. Prioritise it like your life depends upon it, because your life does very much depend on it. Thank you. I'll hand back to the Minister.
Thank you, Brett. Thank you, Tim. How many of the 600 plus? I don't have that breakdown yet. That flows from the data and the material. But given the breakdowns that we've seen over the course of this August-September period, we would imagine, either directly or indirectly, it will continue that same pattern that we've referred to earlier.
Minister, how much did yesterday's violent protest influence the decision to close the construction industry?
Well, the decision's made by the public health team, but as both the Treasurer and the Chief Health Officer indicated, it's a combination of factors. The event itself, which was deplorable and which was an insult to every Victorian who has been doing the right thing and working so hard to get to the other side of this, it in itself risks being a super spreader event, let alone the breaches of the public health orders. More broadly, what the figures that both myself and the Treasurer went through around case numbers, poor compliance and strategies of oversight by the Victorian Building Authority, WorkSafe, authorised officers to investigate those sites, all pointed to the data that we've got from the public health team, which have informed their decision to take the severe measures that are needed to protect Victorians.
Was the shutdown on? Was the shut?
We'll just go this way.
It might be a question for the Treasurer. How confident are you that you can get this under control in 2 weeks and that there can be a total change of mindset for those people to get vaccinated in the next 14 days?
Well, I think we've seen quite a large number. I'm happy to throw to the Treasurer, but I think just from the reports we've had from our vaccination centres and our GPs and others, that we're seeing quite a large number of construction sector workers come forward to get vaccinated since the call went out. But clearly, at the same time, not enough yet, and given the poor levels of compliance and the continued numbers of transmission sites back into households and the regions, the public health team really had no choice, but I'm happy to throw to the Treasurer.
Minister, just before you go, did Cabinet decide yesterday to take these measures?
The decision's made on the recommendation from the public health team, but of course the coordinating ministers subcommittee of Cabinet was convened and received the report and the recommendation and decision of the chief health officers, and that then led the Treasurer and other ministers to immediately seek to engage with the sector together with health.
So that was prior to the, we'll call it a riot, but a mini riot or whatever you want to. That was prior to that?
No, it was a scheduled meeting in the afternoon that is regularly scheduled.
Yeah, but is it prior? I mean, the point being is, had you made the decision before the CFMU issue had arisen?
Well, the decision's made by the public health team, and then that's relayed through the cabinet processes to government.
But you understand what I'm saying? It's important because, well, basically, did you make the decision to shut down construction before the CFMU riot or not?
The decision was made by the public health team, and then that was referred to cabinet processes, and the cabinet processes were during and after that process. So the formal decision, in terms of the public health teams, referred to cabinet, that occurred in the afternoon.
So before the CFMU business.
In terms of the recommendation from the health teams, I'd have to exactly question as to when various events started, but it was well in train. But formally, it was made by the public health team upon recommendation of cabinet. But I'm happy to throw to the Treasurer.
Yeah, well, I think the truth is the public health team were making their decisions around public health issues, probably contemporaneous with the events that were occurring at the time around the CFMEU's headquarters. But of course, the point that we've been making is that these are decisions for the Chief Health Officer. He reports to, in this case, we had advice provided to the Coordinating Ministers Committee of Cabinet. That was after Cabinet had met because obviously we needed to hear what the public health advice in a broader sense was rather than simply the issues that did themselves constitute a public health issue around the location of the CFMEU's head office. Quite frankly, the more concerning issues, the broader non-compliance advice that we'd had right across the industry rather than the rather dramatic events that were happening out the front of the CFMEU offices.
So just to be crystal clear, had the public health team made the call prior to the riot escalating at 4 o'clock in the afternoon yesterday?
Look, I think it would probably be fair to say that advice had gone to us in the CMC meeting that happened about 4 o'clock yesterday. And essentially, I think formally, the Chief Health Officer didn't sign off on orders till later that evening.
I can take you back to Chanel's question.
Protesters right now heading towards State Parliament. That's why you can hear the chopper at the moment. What are you going to do to make sure that this doesn't happen every single day for the next 14 days?
Well, we've made it clear that the actions that people are taking are not helping. As the Premier is want to say, you know, protesting doesn't work against this pandemic, and this is a very substantial circumstance that the state is confronting. While I say it's a profound economic event, but more important than that, it is a profound public health event, and we have to prioritise that. The fact that people are taking the action they are is illegal action. It is against the orders of the Chief Health Officer, and it constitutes a risk to public health. The police will do what they can to manage those events and to bring people into line. But of course, there is only so much that police can do to stop people from not only harming themselves, but putting their families and their communities at risk. So we will continue to seek to enforce the Chief Health Officer's orders around people not congregating and protesting.
Was it a mistake to bump up the vaccine to a mandatory status for construction rather than just keep it at the 90% higher threshold that you initially had in place?
I think you'll find that the government's view around these issues is that it is vitally important that we get as many jabs in arms as we can. And at the moment, we're closing in on 75% of first dose vaccination. So it's pretty clear that there's a fair degree of appetite in the community. The figures we saw the other day is quite a clear demonstration that there is a growing appetite for people to get vaccinated. Importantly, what we do know is that you need to get to pretty substantially high numbers, the 70 and the 80% double-dosed vaccination, before we can even start to the process of the roadmap of reopening in any substantial term. That's vitally important. The thing that gets us back to getting outside of an event that is constantly affected by the presence of COVID in our community is high levels of vaccination. The unions have actually surveyed their membership, and they tell me that 95% of their membership are willing to get vaccinated. So we're talking about a very small rump of the vaccine hesitant. Now, we shouldn't be simply assuming that people who have legitimate concerns about having a vaccine all fall into the category of those who've demonstrated the behaviour that was so abhorrent yesterday. What we do know is that there are a lot of people for cultural, for communication issues, for a variety of reasons, have concerns about the vaccine. We have to engage them and we have to give them a clear appreciation that this is about their health, it's about their community's health, it's about getting back to a way that our community can operate and our economy can operate in an effective way.
But given the intention is so high, 95% you quoted, which is well above the 80% that we need to get to, will you rethink mandating the vaccine for non-healthcare worker sects of the economy, given the reaction that we've seen in the past 24 hours?
I think the government's position is clear that the Chief Health Officer has the power to make decisions about mandating. We support the Chief Health Officer in making those decisions effectively on a proportionate basis. He has to decide which industries constitute a risk to the public, and they're not all just public health industries. As we've seen today, the level of spread that's occurring right across our construction industry being amplified back into communities and then back into the construction industry and who knows wherever else because of the movement that we're seeing, some 4 times greater movement by an average construction worker than, say, a retail worker, some 20 kilometres as opposed to 5 or 4 kilometres. So those are decisions of the Chief Health Officer. He makes them proportionate based on the need to protect public health, and we would expect that there will be more industries that will be identified where risk is presented to the community and needs to be properly managed.
Can we ask the Chief Health Officer?
If I can just go to the Treasurer first, if that's okay. What's specifically being done to get construction workers vaccinated by October 5? Do you think 2 weeks is enough to get everyone to have a single dose?
Well, I think all the work that we've been keeping you appraised of over the last few months is really coming to into its fore at the moment, and we've seen the spike in vaccinations that occurred yesterday, but it's been a substantial problem in terms of supply. That supply issue is, at least in the short term, been abated due to the Moderna dose being available. And of course, we've made the AstraZeneca, an unlimited supply of AstraZeneca, available to the construction industry. Industry players, including Incolink, are going about their job, making sure that people can get vaccinated. That's on top of the access to state-run vaccination facilities, and of course the chemists who are doing it. So I don't think there's much of an excuse that people can't get access to the vaccine. There's opportunity now and there's time. Please, people should be taking that opportunity. This is our one way out of this. It is the most effective way through it. We have to recognise that coronavirus will be endemic in the community going forward. That means we have to protect ourselves with the vaccine, and the best vaccine you can get is the one that's available to you now.
Can I just clarify with you?
Is saying that there's a lot of misinformation, a lot of people falling prey to things that they're reading online. Is there any way that you're going to de-radicalise, say, people that have got some quite extreme views on vaccines?
Well, I think the first thing is to not assume that everybody who has a genuine concern about vaccines is radicalised. But we also need to recognise that there is a lot of misinformation in, well, online forums in particular. And it's an unfortunate bubble where people's views and concerns get amplified, and some of them are entirely irrational. But there are legitimate and rational concerns that people need to express. I think it's pretty easy to spot the rational concerns, which go to people's health and the health of their families and those nearest and dearest to them. So I think that people should engage. We should provide the opportunity to hear people out when they've got a concern about the vaccine. These, as the Chief Health Officer said on many occasions, if we listen to the science, then we will be guided to the proper way through this event. And effectively, what we need to recognise is that we've got an argument with 5, maybe 10% of the population. But it doesn't have to be in hectoring or badgering terms. It has to be a respectful discussion with people about legitimate issues. If these are irrational concerns, if people have irrational concerns, well, I understand that ultimately they'll be making a choice for them and their circumstances, but they can't make a choice that adversely impacts upon the well-being of the rest of the community. So, as you will find, as we move towards greater vaccination levels, as we move towards those industries that the Chief Health Officer sees as being appropriate to mandate for vaccination, and as we provide greater freedoms to the vaccinated, I think the arguments will be compelling, and people will see that we are opening up our economy and our community and getting through what has been close to 2 years of considerable sacrifice by the community at large. We can't have that jeopardised by a small minority.
Can I just clarify the industry ban, does that apply to landscaping and also to things like roadworks?
Landscaping on construction sites, yes, but landscaping in all other locations is fine.
So landscaping in a private home that isn't
landscaping at home
is
not affected by these orders.
Okay, and what about roadworks?
Roadworks are civil construction, and they'll be impacted by these orders.
Because there's roadworks that, like I've been driving around this morning, there's roadworks still going on.
Yep.
Why haven't they been wound up? Like, for instance, the Kew Junction project, that is still.
Well, once again, we've indicated
that.
there'll have to be a demobilisation process that I took you through. We can't simply leave half constructed or half finished work with hoardings up and so forth, but they have to move immediately, expeditiously, to make those sites safe and to get off those sites
How long
effectively.
is the amnesty?
Well, it's however long it takes, but we wouldn't expect this to go much longer than 2 days.
Is there a compliance
work sites in general, a lot of the issues that were found at the end of last week were at smaller sites in particular. How are you going to make sure in 2 weeks that when sites open up, they're going to be a lot more compliant? What gives you any confidence that people, especially at those smaller sites, all of a sudden in 2 weeks are going to reverse their behaviour?
Well, I think, firstly, the reality of checking and authorisation, inspection by authorised officers, I think is a pretty important part of that equation. The fear of apprehension drives behaviour in many respects. Additionally, what we will know by that time is that every worker on site will have to have been vaccinated, and will have to be satisfied about that. The Chief Health Officer will have to set up a process to satisfy himself that his orders are being adequately acquitted on each of these locations, and the government will continue its enforcement systems to satisfy ourselves that the Chief Health Officer's orders are being applied.
Is a fair proportion of the many small business tradies in the suburbs that are doing the right thing? What support is on offer for them, and what about for the families that have got renovations happening at the moment that have been forced to move out of home?
Firstly, is it proportionate? Absolutely, it's necessary, and I think the numbers speak for themselves in terms of the proliferation of the virus through the community. But I'm not an epidemiologist, and I'm not a Chief Health Officer, but certainly we support the decision that the Chief Health Officer has made to keep the entire community safe. This is an industry that has had a permitted worker status for most of the events that the community's endured, and it's been in a position that is different from and better to so many more people who've suffered from the consequences of this event. So they haven't received a great deal of government support or assistance up until now, but we recognise that, of course, the Commonwealth disaster payments, $750 will be available for those workers who've lost work of more than 20 hours, and for those who work more than 20 hours rather, and $450 will be available for those who work between 6 and 20 hours. Of course, the government will now have to recast some of our business support payments, given that this industry has not previously been eligible for such payments. We'll have to consider what we could do, and in the next couple of days, Minister Pakula, perhaps the Premier, will have more to say about what that looks like while I work through those issues with them.
Can I just ask the Chief Health Officer essentially the same question? Brett, does the negative reaction that we've seen in the past 24 hours and probably currently at all change your opinion on mandating vaccines for groups like teachers and others coming forward?
Look, they're always difficult decisions, and you're balancing really critical elements in coming to those decisions. The reality is the urgency of getting vaccination coverage is really acute. The Burnett modelling also looked at what it means to prioritise to get high coverage for authorised workers versus not. And it makes a difference of hundreds to thousands of cases, and ultimately that's potentially hundreds of deaths through November, December and beyond. When we had a blitz offering up the vaccine for construction workers and it was voluntary, there wasn't a terrific response. I think that goes down to the sense of urgency, not about an unwillingness to get vaccinated. Having a mandate with a date that brings forward the coverage very substantially, I think is a really important element, because it's that high coverage that will allow the industry to get back to work, but it will be a genuine protection for them as individuals, for their workmates, their families, and as we've heard, the broader community, because they do make up a not insubstantial proportion of workplace infections and community infections.
To stoke urgency, could we not also achieve the same by setting like an 80% or a 90% target rather than that 100% to avoid this negative backlash?
So the target was there, and we didn't get the kind of urgent response required. And when you say 90%, well, everyone thinks it's the other 90% who will come forward. So that becomes difficult. And I guess those were the same considerations for New South Wales when they mandated for every single authorised worker in their determinations, because they have moved very quickly to high first and second dose coverage in the authorised worker workforces, and indeed as a result in their hotspot areas. And we've seen the plateau in cases in southwest and Western Sydney in particular that I'm sure is a direct response to that, and the same plateauing in the numbers hospitalised in New South Wales. That is a protection of the health system, but again, behind every one of those numbers is someone who's not dying, who's not in ICU.
Professor Sutton, what's your message to the construction sector, and why did you recommend the government to shut down?
So, I mean, my message is these are difficult decisions in the same way that all of Metro Melbourne plus a number of other LGAs are in lockdown. That is a broad brush approach that is always hard to differentiate between those who are breaking the rules and wanting to break the rules and everyone else who's wanting to do the right thing. You have to... I can't pick out those very, very many construction workers who are doing the right thing and say, oh, don't worry, you can carry on working, and try and identify those who are doing the wrong thing. We have to take measures that change the behaviours across the industry. As the Minister and Treasurer have said, the compliance issues were very broad. That is not to say that it represented every single construction worker. There are so many who are doing the right thing. But transmission was occurring and it was very substantial. And there are lots of subtle behaviour changes that need to occur that are not always acute in people's minds until you make a determination like this. You know, wearing a mask, some people just don't see how critical it is. But in the same way that you don't wear a hard hat on your elbow, you wear it on your head. Masks on chins were not doing the job in construction, and transmission was occurring. It does not stop at a tea room, COVID-19. That's where transmission's occurring. So these decisions that impact everybody, but might actually apply to a smaller proportion of people who weren't changing their behaviour sufficiently, you know, that's the direction we needed to take. So very tough, and I want it to be in place for the shortest possible time. I think we'll see a turnaround, and I think people will reflect on what it means, what you have to do in order to get back to work and the industry up and running again.
The compliance checks that have been occurring over the past week, were they random spot checks?
Oh, they were very broad. There were thousands and thousands of sites that were visited. So in a sense, they were random because they weren't just focused on one, you know, small or large construction sites or metro or outer suburban. They were across the board. But the issues differed in different settings. But there were, you know, genuine concerns about compliance, and sometimes that's about not having a COVID-safe plan, but sometimes it's also about what is seen on those inspections. So it was a very broad look, and again, we got the feedback yesterday. That was part of my concern in coming to my determinations.
So was this the first time you suggested shutting down the industry?
The question's been live for, prior to yesterday. We've been talking through, and as you know, we've been trying to address, again, with that proportionality issue in mind, how best to manage transmission risk. So the mandating for vaccines, the restrictions on movement into regional Victoria, the caps, the closure of tea rooms, they were all measures that have been live prior to yesterday, but certainly through the course of yesterday, with that compliance data, with other concerns coming through, that got us to the pointy end of decision making for sure.
What exactly was it that changed yesterday then? You say other things, compliance, that data coming through. What was it that changed yesterday where you went, right, that's enough?
Well, look, there had been that almost full week of compliance checks, and it would have been very reassuring if we'd seen that there'd been a change over that period of time, or that the issues were confined to one part of the sector or one geography. And that wasn't the case. There were broad non-compliance issues, and I think compliance isn't the only element that makes you concerned about transmission, because you can have a fully compliant business and transmission still occurs. It's the volume of interactions between people. So, look, it's a combination of the continued reflections on how transmission was occurring within Metro Melbourne, but also beyond metropolitan Melbourne, ultimately Ballarat, Greater Geelong, and other places in Mitchell Shire were related to construction, and the movement across metropolitan Melbourne was in no small part related to construction as well. That movement data, we saw that people who work in food retail, supermarkets, they move about 5 kilometres from their home on average. Construction workers were moving on average 20 kilometres, and many of them much more than 20 kilometres. So it's not just an issue of the transmission that's occurring, it's the new seeding into other areas, and that is a concern because it leads to the widespread transmission across Metro Melbourne and beyond.
Just two non-construction questions. Did you refer to an aged care facility in Meadow Heights earlier? Can
Yes.
you provide the name of that?
So I believe it's Meadow Heights Aged Care Facility, but I can come back to you if it's different.
Right. And just for maybe the Treasurer, if you wouldn't mind, the events industry says they've done a survey which shows 27% of events businesses will survive this lockdown. Now, they're after a major events task force to prevent this from happening, and they're concerned that Victoria is going to lose its status as the major events capital. Are there any plans for such a task force, and are you concerned about the city losing its status?
Well, I can't answer directly to the issues associated with the task force because their matters are probably best directed to the Minister for Major Events. But obviously the best way that we can get our major events industry up and running again is to adhere to the roadmap that the Premier has identified, consistent with our obligations through the National Cabinet. That's why we're taking the actions that we are. We understand that we have to open up our economy. As the Premier has already indicated, he's hoping to see that our Melbourne Cup will be one of those first events where we'll be able to have crowds. The race that stops a nation starts our major events calendar. That's the aim, and there'll be more happening in this space going forward as we get heightened levels of vaccination and comfort that we can open up safely. Ultimately, the decisions about what events, what crowd numbers, still have to be looked at through that public health lens, and that's a matter for the Chief Health Officer to decide. But we're all looking to having a much better Christmas as a consequence of the roadmap, as a consequence of everybody's commitment to getting vaccinated and to adhering to public health orders. And we expect that the major events industry too will have a better time ahead because of these actions.
Do you believe the majority of the protesters are members of the CFMEU?
Oh, look, I'm not the membership or recruitment officer for the CFMEU, so I couldn't really testify to that, but I think they know their membership pretty well, and they've said publicly that they believe that the protesters who are out the front of their headquarters, their membership was in the minority of that group. You're probably best to direct those questions to them, but I will just reinforce the comments that the union movement, the ACTU, have made. The sort of conduct we saw yesterday is not consistent with the values of unionism. And we have a right that we all cherish to protest in a safe and effective way, to make our point, to make government listen. In the current environment, in the middle of a pandemic, having a mass gathering has the real risk to be a super spreader event. But then to exacerbate the situation by the levels of conflict and human interaction that was presented in that event, I think is nothing short of a public outrage. And quite frankly, the people who conducted themselves in this way, I think, are so far removed from the values of most Victorians as to constitute aberrant and outlying behaviour.
Just on the economic impact of the shutdown quickly, I think Master Builders Victoria estimated about $1 billion a week. What does the government's figures show on how much it's going to cost with all construction shut down?
Well, look, we're still doing work on that, as you'd appreciate. Our priority is to make sure that the CHO orders have been given effect to, and we've got to now proceed to make sure that the demobilisation strategies are effective. I think looking at the numbers of the size of the economy, around about $470 billion, the number of employees in the industry, direct employees, about 10% of the workforce. It's probably right. It's in that order of magnitude. I'd probably think it might be a little bit higher than they've stated, but not massively overstated.
You've all been very helpful today, but a lot of people at home are wondering where the Premier is, given the big decision made last night.
Well, I'm surprised that you wouldn't actually want to see the Industrial Relations Minister and the Treasurer on a day like today. Look, I know you all enjoy the Premier's company more than you enjoy my company, but I just make the point that the Premier does need to attend to the business estate on occasion. I don't think anybody could criticise his willingness to front the media. In fact, I sometimes express concerns about his work ethic, his inexhaustible work ethic during his marathon of media events last year. I think he's trying to get a better balance to make sure that he's there, but also he makes sure that his senior ministers, particularly the Health Minister, get the opportunity to front the media and basically stand to account for the portfolio responsibilities that we have. Sure, that's one back here too. You go.
Just for the Health Minister.
Oh, sorry.
I think I heard last question 10 minutes ago, but anyway.
Yeah, New South Wales has today formed a friends bubble which would allow groups of 3 people under 18 to hang out. Is that something we'd consider here, and if not, why not? Why are we so different to Sydney at the moment?
Well, I don't know the details of the New South Wales proposal, but we already do have arrangements for intimate partner bubbles and gatherings as part of the roadmap around numbers of people who can get together publicly depending on your vaccination status. But any good idea is one that, of course, the public health team would look at. We all good?
Professor Sutton, if I could. The 403 cases directly linked to construction, are they all workers or are some household contacts?
I think some of them are household contacts, and we don't always get the employment status data from individuals necessarily. So I think that the actual direct links into construction will be greater than that number, but we have seen transmission to other households, transmission to other work colleagues who are not in construction. So the effect is not insubstantial, but I do believe that it does relate to those close contacts as well.
And just on another matter, can you share what your direct advice was on the return to school?
So the direct advice is as you've seen in the roadmap. Yeah.
Just a couple of weeks ago, the state government announced an increase to the JAB army by getting nurses, doctors, dentists, all that to carry out vaccinations. Do we have an update as to where that is and how many people have taken up that option?
No, not specifically in my purview. It's really for the State Controller and the acute hospital sector to work through that, but there is absolutely a need to mobilise anyone who's got the skills and competencies, really. We shouldn't constrain ourselves to particular credentialing. We need individuals who can do the job and are willing to do so because we've got massive tasks across testing, across vaccination and across clinical care that are all ramping up at the same time and are all really important to managing this pandemic. So I know it's being looked into, but not really in my area.
All good.
Thank you.